Good morning. Are you checking in?
Yes, I am.
And who are you seeing today?
Rude
Okay. And last name?
Smith, 4321.
Thank you, Jim. Any changes with your address or phone number?
Yep.
Okay. I have you, and you said you didn't go to lab already?
No, I haven't been to the lab yet.
Perfect. I have you all checked in. If I could have you fill out this whole health form for Ashley, you can give it to the nurse when she calls you back.
Okay.
And then I have you all checked in for your appointment.
Thank you.
You're welcome. You have a good day.
Hi, I am your nurse today here working with your provider. I do see you answer the questions here for me ahead of time. The reason we're asking these questions is because what matters most to you matters to us. We have a new whole health consult that we have available through the VA. In regards to these questions, our first one was, what matters most to you? I see that you have your family on there. That's amazing. How many kids do you have?
I have two grown daughters,
Okay.
and the oldest is we're expecting our first grandchild
Woo!
in September. So
Okay.
that's at the top of my mind.
That's exciting. Congratulations.
Maybe being alive for that.
Okay. Our next questions that we ask will have you rate on a scale of 0 to 10. 10 is all the time. 0 is none of the time. The first question is, over the past month, on average, how often have you been fully satisfied with how things are going?
More often than not, I would say about a 6 or 7 or something like that.
Okay. And the next question is, regularly involved in things that are important to you?
Yeah, well, on a monthly basis. Probably about the same.
Same
about
thing.
6 or so.
And then functioning your best in the most important things you do.
That's probably about the same, about 7.
About a 7? Okay. I will go ahead and document these in our chart, and then the provider will discuss a little bit further, just so you are aware. With our whole health consult, we do have whole health coaching along with Tai Chi, yoga, meditation. We have heard a lot of positive results with our veterans with decreasing their pain, decreasing hypertension medications, with all these new things that we do have available. So thank
That's
you so
awesome.
much for your time, and I will let the provider know you are ready.
All right, thank you.
Good morning, Jim, and thanks for coming in today. My name is Ashley, and I'll be your provider.
Nice to meet you.
Good to meet you. So the nurse gave me a little bit of info about you, and that you filled out this whole health form for us, and I see that what matters most to you in your life right now is your family, so that's great. And in the questions down here, over the last month, you said you were fully satisfied with how things are going. You gave yourself a 6 for that. Regularly involved in things that were important to you, you also rated that a 6. And then function at your best, you put that a 7. Just looking at these numbers, they're pretty good, but is there anything that you think we could do to help you get those up a little bit higher?
Well, yeah, I do struggle with low back pain, and I feel like sometimes it kind of limits me. So that's probably, if I could get that kind of nailed down and get a little more mobile, I think that would probably help things.
Yeah, definitely. What would you rate your pain today if you had to give it a number?
Oh, probably like a 4.
4. Okay. What have you done in the past that's been helpful or not helpful?
Well, I've tried walking and a lot of times at home I'll use a heating pad and things like that. I don't like taking pain medication. I honestly, I don't keep it. I don't even keep it in the house. It makes me foggy and dozy, and it's just not helping anything. And so I'm trying to see what other alternatives are out there to address that.
Absolutely, and we have a lot of options. What do you think about Tai Chi or a chair yoga?
Yeah, I've heard about Tai Chi. I think that's an interesting place to start. you know, I've got other vet buddies at the DAV and at the Legion, and you know they've talked about it, and I'll try anything once, maybe twice if I like it.
Wonderful. Well, how about I go ahead and put a consult in for Tai Chi for you to get started on.
Okay.
And if you're not seeing any improvement in that, we could try the chair yoga or physical therapy,
Okay.
or maybe we'll have to get an x-ray just to check on things for
Uh-huh.
you. All right, well, I'll go ahead and put that consult in. They'll be in contact with you to get it scheduled. And then how about we plan on following up with you in about a month just to see how the back pain is going.
Sounds perfect.
Okay. All right. Great,
right.
Jim. Thanks
Thanks.
for coming in today.
Thank you.